Welcome to the clinic today. We are going to be looking at your dry eyes. So, your optician has referred you here because you've been experiencing some severe dry eyes. So, this is what we're going to be focusing on today. Doing some tests for dry eyes and potentially curing or ameliorating your symptoms. So, a little bit about dry eyes. So, dry eyes, chronic long-term condition, and it can come back, and it can clear up and come back again. And dry eye is more common in women aged over 65. We need to just familiarise ourselves with the tear film there. That's your tear film. So there's a outer, middle, and mucin layer. And you see the tear layer there. So aqueous, biggest. So that's your tear film. And there's 3 layers, and one layer could be deficient. And there's dry eye symptoms: gritty, sore, and red. And watch the environment: high temperatures, air conditioning, for example, drafty conditions. Mentioned about lubricants. Lubricants could help. Shall we have a look at your dry eyes? See how dry they are. Okay. So, first test is using this Schirmer strip. You see the Schirmer strip on a little scale? This is going to measure the volume of tears that you produce. So we just bend the top, like so. Place the strip under the bottom lid. Feel free to close the eyes if you wish, and after a short while I will measure the volume of tears. Okay, so starting with the right eye, let's do a Schirmer test. Look this in there. Look up for me. Look up. Okay. So if you keep your eye open if you want to, and I'll give it a few seconds. So you just relax. Take some notes. Schirmer test, right eye. Test. Might feel a little bit uncomfortable with the strip in your eye. Keep relaxing. Test right eye. It measures the tear in millimeters. Grab the Schirmer strip now and have a look. There we go. I'm going to have to use this lens to look, so I forgot my glasses today. So we are measuring 4 millimeters of tears. Just 4 millimeters. Just a little bit low. Schirmer test for the left eye now. Schirmer strip for the left eye. So if we bend the top, bend the old boy there, and slot this into the left eye, so looking up for me. There we goes. Okay, try and hold it down. It'll be a little bit uncomfortable. And we'll see how this one comes out. Okay, just relax. So, right eye was 4 mil, so that's low, very low. Tear quantity is a little bit very reduced there. How are you doing there? Okay, let's remove the Schirmer strip for you. Ah, yes. I really should have brought my glasses today. Okay, Schirmer strip. 5 millimeters on the strip, 5 millimeters. So you're not producing an awful lot of tears. So this could be exacerbating your dry eye. So right, 4 and left did we say 5 millimeters. Okay, so next we are going to have a look on the good old slit lamp using some yellow dye. So we can use the yellow dye, a little orange strip here. The dye will bind to your tears, and then we can check the evaporation time of your tears. Just looking up to the ceiling, this doesn't sting. Right eye. Left eye. Good, just blink for me now. I will dispose of this. Right. We must press on because the dye won't stay in the eyes for very long. We're going to darken the room lights. Okay, just bear with me. Excellent. Okay, so if you're sitting comfortably, head against the top, brilliant. Okay, looking at my right ear, please. Take a blink. Looking up. Down. Looking to the left and the right. Good. Now when I ask you to blink, I want you to stare for me, please, after the blink. So, take one blink now. 1, 2, 3, 4, 4 seconds. It seems that the tear film in your right eye evaporates after 4 seconds. let's move on to the left eye. Looking at my left ear, please. Okay, take a blink for me. Look up. Looking down now. Looking to your right hand side. And the left side. Fantastic. Okay, now blink and stare. And again, blink, now stare. 5 seconds. 5 seconds. Okay, I'm just going to pop the room lights on now. Watch your eyes. There we go. So, using the fluorescein dye, we have checked the tear breakup time. TBUT for short. With fluorescein, right eye, the tears are evaporating in the right eye. You have a break in your tear film after 4 seconds. Left eye, we had 5 seconds. So everything at the moment is pointing towards severe dry eye. So what we need to think about now is how to improve your condition and make life a little bit more comfortable. This is where I have a little plan, a little management plan. We have some punctal plugs. Can you see my punctal plugs? Now the theory is, if we can place a punctal plug in the lower tear ducts, starting with the lower tear ducts in each eye, they will reserve some of the tears on the front of the eye. So if you have tears draining less quickly, there will be more on the front surface of your eye. Thus the symptoms of your dry eye should dramatically reduce. So shall we apply a punctal plug in the lower right tear duct? I think we should. It's a very delicate job, this. But it shouldn't hurt. Okay, there is your punctal plug, right there. So, starting with the right eye, let's insert this little plug. Just looking up to the ceiling for me now. Up to the ceiling. Okay. Punctal plug is slowly going in there. Just relax. Good. I will come away. Good. Just take a blink. How do you feel? Fantastic. Okay, so because we have dry looking eyes each eye, we will do the left next. looking up for me now. There he goes. Into the left, into the left. Lower left. Punctal plug. Punctal plug. Good. There it goes. Brilliant. How do you feel there? Wonderful. So you are now the proud owner of 2 punctal plugs in the bottom duct of both eyes. Let's just have a look on the slit lamp how they're looking. I'll turn the brightness down for you. Happy? Right, looking at my right eye for me now. Very good. It looks to be in place. Let's have a look at the left eye now. Okay, looking at the left ear for me. Brilliant. Not too bright. Just have a look at this plug here. And it seems to be in position. In position. Fantastic. Extremely happy with those punctal plugs there. They will dissolve after a few months on their own, so there's nothing to worry about. But there is one other thing I need you to do every day. So if you stay there, I will go and grab another important piece from your management plan. You need to be using some lubricants in your eyes. These don't sting at all. They are preservative free and they last for 6 months once the bottle has been opened. And they contain 0.2% of sodium hyaluronate. You've got a protective cap there, protective cap. Just looking up for me and I will instill your first drop there. There we go. Take a blink and move the lubricant around in your eye. Left eye now, left eye. Blink again. I'll package the drops up for you. There, now we have a management plan for your dry eyes. So, I'll take some notes on what we found. So punctal plugs, each eye. Successful. And some red lubricants to use every day, 3 to 4 times a day. Maybe more if you need to. Red lubricants each eye. We'll say 4 to 5 times. 4 to 5 times per day. Okay, so see how you get on. And we will probably send for you to come back here in, let's say, 1 month's time, after you've been using the drops and the punctal plugs have been doing their work, and you'll probably receive a letter. So I'll see you in 1 month. Cheerio.